So more Americans will soon be able to get health insurance coverage through the Affordable Care Act. People can start enrolling in what's called the health insurance marketplace on October 1st. It takes into account family size and income to find the cheapest insurance plan possible. In Iowa, the only two insurance companies taking part in the marketplace are Coventry and Co-Opportunity. Now, many are comparing this health insurance marketplace or exchange to Expedia or Travelocity websites when looking for cheap airline tickets. Now, we have a chat that is set up right now on KCRG.com to answer your questions about enrolling in that marketplace or any questions really in general about the Affordable Care Act. Mercy Medical Center President and CEO Tim Charles will be answering those questions himself. And our live chat continues on KCRG.com. Mercy President and CEO Tim Charles is taking your questions on the Affordable Care Act. Head to our website to submit your queries. Are you confused about the Affordable Care Act? We have Mercy Medical Center's president right here. You see him there with his laptop to answer your questions submitted through our website. We'll talk to him in an interview about what all this means for Iowans. Stay with your 24-hour news source. He's working so hard. KCRG TV 9. Iowans who don't have insurance or who want to change their insurance provider will have a chance come October 1st. That's the day when people can start enrolling in the Affordable Care Act's health insurance marketplace. Mercy Medical Center President and CEO Tim Charles joins us now. Thank you for being here. Take a moment off the keys. Full disclosure, Tim and I serve together. I volunteer and he is CEO on Mercy Medical Center's Ethics and Mission Committee. It's been a pleasure, but we want you to know that right off the bat. First of all, what kind of questions are you getting not only on this forum, but just in your general day-to-day about what is coming October 1st?
I think what we're seing is that there's an awareness that October 1st is a big day.
Yeah.
And it really is when the Affordable Care Act goes live, so to speak. What I think individuals need to recognize is that the open enrollment period actually allows time to go out and research the various options that will be available and to find the product that's going to best suit their needs and be most affordable to them and their family. You need to enroll if you want to have coverage by January 1 by December 15th. But you actually have until March to actually enroll into the new marketplace.
So for people who are uninsured and for people who are insured but don't like their insurance or want to see if they can maybe get it cheaper, what do they do between today and October 1st to get ready for this enrollment opportunity?
Well, I would say that between now and October 1st, you can begin your education process, but understand that the details are still evolving. The systems are still being put in place to enable the enrollment. And also learn what the rules are. Because those of us, for example, who can purchase insurance through our employers may be required to continue to purchase our insurance through our employers. We won't be able to just say, well, I don't like that. I'm gonna go over here. But certainly for those who haven't been able to access insurance, they now have options they didn't have before.
With just a few moments left, is the hospital, local hospitals, yours specifically, doing anything different to anticipate October 1st enrollment period?
What we're doing is we're ensuring that we have individuals within the hospital, individuals within our clinics that can answer the questions.
And I'm sure there are a lot.
There will be many.
Still, stay with us. Go online if you have more questions. Thanks so much, Tim. A big part of the Affordable Care Act, better known as Obamacare, starts on October 1st. That's when Iowans can start enrolling in those state market exchanges where the health insurance providers that are participating, there are two statewide right now, are up for grabs for Iowans who are interested and eligible. So some people, well, we should say a lot of people, are asking questions, and we want to hear those questions. But first, the exchange. So Iowans are going to be able to look for other health care plans. It's similar to a marketplace for health care insurance. We now know a second insurance has committed to this exchange. Coventry will be joining Co-Opportunity Health. The insurance division has not released complete pricing estimates yet. We know that's a big question for folks. But Insurance Commissioner Nick Gerhardt says that for similar plans, quote, Iowa's rates will continue to compare favorably. So that sounds pretty positive. President and CEO of Mercy Medical Center in Cedar Rapids, Tim Charles, joins me now. And Tim, you've been taking people's questions through our online blog. It's happening right now, as well as with a representative from Co-Opportunity Health Insurance. He's also helping you answer some of those questions. So One of the questions that people have been asking, and I know you've probably gotten this, what if it's repealed? We hear so much talk about people don't like it in politics and elsewhere, that what if Obamacare disappears?
Yeah, so the first thing that I would say is I would caution individuals that might think that they should wait to see if it may be repealed and somehow miss the open enrollment period. So I would encourage individuals to do their research, see if they qualify, and if they have an opportunity to find a product that works for them on the exchange or now in the marketplace, as it's called. Secondly, I would say we're not anticipating that it's going to be repealed.
Okay. There's a lot of talk, but a lot of hot air maybe?
Yeah.
So October 1st, big enrollment deadline. That's when people can start enrolling for the healthcare exchange. So everybody, me, you, who's really is this for?
You know, it's actually, it would seem that there should be a very simple answer to that question. But the reality is that it's a complex system, and depending on your individual circumstances and your individual needs, because you're going to have options, you need to, again, go to a resource, and I would suggest going to www.healthcare.gov to begin that research process and have your questions answered through that.
Healthcare.gov, I've been on it this afternoon to prepare for this exchange, this interview, and it answered pretty much every question that I had. So I echo your suggestion. If you have a question, Tim is here. We also have someone from that insurance company online to answer your questions. Please go online and submit those questions and read through it. It was really rich discussion happening. So thank you for your participation. There are still major questions regarding the Patient Protection and Affordable Care Act, better known as Obamacare. For instance, who will be covered in the new exchanges? How much could that coverage cost? And what will be the impact on Eastern Iowa hospitals and primary care clinics, the doctor's offices? KCRG TV9's Chris Earle continues his research into this complex and somewhat evolving topic and joins us from our newsroom with answers to these critical dates that are coming up. Chris?
Well, at least we have some answers to this point, Beth. Wednesday was the deadline for private firms to sign on with the state of Iowa's health insurance marketplace, also known as the exchange. Two companies will operate across the state within the health marketplace: Coventry with Unity Point Health at St. Luke's, and Co-Opportunity with Mercy Medical Center and UIHC. Open enrollment in Iowa starts on October 1st, yet we are still awaiting the final pricing details and also what may happen on January 1st once the coverage starts. Between Unity Point Health and Mercy Care in Cedar Rapids and University of Iowa hospitals and clinics in Iowa City, these are crucial days before October 1st.
So much of this has been evolving since the passage of the Affordable Care Act, and the details are late in coming.
First, a look at price, as the official numbers are not out yet. Iowa's insurance commissioner says Iowa should have lower prices than other parts of the country. Yet Dr. Keith Mueller of the UI College of Public Health said it's hard to predict and offers this wrinkle also.
Most of the predictions were the rates would be moderately higher through the exchange because the people who are coming in, the insurance carriers would anticipate higher use, particularly in the first year, if they've been delaying care or not getting adequate care.
This point leads to this possibility after January 1st. Where will people who have not been carrying health insurance go for their newly purchased coverage?
We are preparing for more clinic visits, and that's really the intent, actually, in keeping people healthy and really engaging them in their health care is to have more of those clinic visits.
Typically, someone who does not have health insurance that is afraid that I can't afford it will delay seeking primary care and end up in an emergency room because they just have to get care.
Which leads to an autumn of anticipation for what works best.
Individuals who would like to have coverage by January 1 need to have made a decision by December 15th. So they have October and November to do their analysis.
Look at what's being offered, compare prices, compare the value.
As for the eligibility, the website healthcare.gov can guide some people through this. It's all right there on the front page of the website. There's no hard line of income guidelines that we can say here that makes a person eligible or not because a person's age, any pre-existing conditions they may have, the number of people in a home, so many variables to consider. On KCRG.com, I do have an extended article with more examples of income and the size of a family for eligibility for some of the lower priced insurance through the marketplace, or whether they would qualify for Medicaid or paying the full rate on the new marketplace or the exchange. So it's still very, very complex, Beth.
It is, but if you do a few clicks through that, that guide, it can really answer some questions. It is helpful. Thank you so much, Chris.